There is no need for people not to have confidence in the vaccination programme. It will be very comprehensive. It will be ramped up as further vaccines are authorised and made available to us. The only limiting factor at the moment has been the supply of the vaccine. And the only significant volumes we have received to date are from Pfizer-BioNTech, which has enabled us to prioritise both frontline healthcare workers and the residents of long-term care facilities and the staff in long-term care facilities. And that will be the priority up till the weekend, when by Sunday we will have all staff and residents in nursing homes, long-term care facilities, vaccinated with their first dose. And we'll potentially up to about 70,000 of frontline healthcare workers. My understanding is we've delivered or have received about 152,000 vaccines. By next Sunday, 142,000 of those will have been administered. So we are literally getting the vaccines out as we get them in to the country. We have a much more comprehensive and detailed plan in terms of ramping up then the volume for the next phase, particularly after the authorisation, hoping that will go well, of the AstraZeneca vaccine, which should be on the 29th from the European Medicines Agency, and then for delivery in their timeline for mid-February. That would be followed then by the Janssen vaccine sometime a month after that in terms of authorization. A bit later on, we will be getting more supplies in Pfizer-BioNTech and Moderna. So there will be a very significant ramping up. You've identified workforce issues correctly, and we have GPs and pharmacies ready now to go in terms of AstraZeneca and others vaccines, and we're also working in terms of expanding that workforce so that there will be a full national campaign to vaccinate the nation as soon as we possibly can. And I can let the Deputy no doubt that we'll be doing that. And the workers that you have represented today and articulated on behalf of today are, in my view, workers on the front line, particularly in the home care context. And, you know, I feed that back into the National Task Force. We take our advice on the clinical priorities from the National Immunisation Advisory Committee, headed up by Dr. Karina Butler and NEFIT, and that's the basis upon which we decide the sequencing and the prioritisation of those who get the vaccine. The vaccines at the moment have been, their main, the evidence base for them is that they reduce illness and they reduce mortality.
Thank you, Taoiseach.
Hence the necessity to vaccinate the eldest in our society, the most vulnerable in our society,
Thank you, Taoiseach.
and
Time
those
is
on
up.
the front line. And if we do that, we reduce mortality, we reduce risk, and we reduce illness